Hello, Lynn Watts again here. And today, what I'll be talking about is recognizing some of the symptoms of trauma or PTSD in children. So, some of the symptoms, of course, are similar to what you might see in adults, but there are others that are certainly very specific to children. So, there's 7 different symptoms I'm going to mention, really just kind of in a pretty quick summary of the different symptoms. The first one is re-experiencing the trauma. And this may occur through a lot of different ways. They may have nightmares about it. They might have a flashback where they feel like they're back in that situation, can't forget about it, can't control their thoughts. And similarly, they might have intrusive thoughts where they just repeat over and over again mentally what happened during that situation. The second thing or symptom might be avoidance of some particular type of situation, and that might be something related to the particular um, trauma that happened. So it may be that they are unable to revisit a place or even a place that's similar. For instance, if a trauma happened in a playground, maybe they won't go back to any playground. And certainly it could be a place, it could be a person that the same person that was involved in the trauma, or it could be someone who just reminds them of that person, or it could even be an activity. If they played a certain game and then experience some sort of trauma, perhaps they refuse to even play, or maybe just play specifically that game. Another another symptom is emotional numbing. And this occurs when a child, you might expect that they would be upset, but in actuality, they seem very detached and seem as though they have no feeling whatsoever about the situation. So, this is a way that, of course, they protect themselves from the depth of those feelings. On the other hand, a child might experience increased anxiety and arousal. So this could show up as difficulty sleeping. They might be hypervigilant, always on edge, always expecting something to happen. They might be easily startled, or they might have trouble concentrating. So oftentimes we get referrals for children who don't seem to focus, and it's always important just to check out what the cause of that is. Um, there might also be increased irritability or even angry outbursts. So a child might have temper tantrums, or they might become very upset and irritable over things that are very minor, and that it seems kind of surprising that they would be have such a reaction to something so simple. Regressive behaviors are always something that is an indication in children that something may be going on. And in particular, they may return to some sort of earlier behavior. It may be bedwetting, it might be sucking their thumb. They might become very, very clingy, even though they were previously a very independent. And then finally, we often, of course, find children that have physical complaints that there seems to be no obvious physical cause for. And so sometimes that can be an indication of some sort of trauma or some sort of emotional issue. So, ongoing or repetitive headaches or stomach aches or other physical ailments that it's very difficult to understand or find the cause of. So, those are 7 different symptoms that I think we always need to keep in mind whenever we have a referral for a particular behavior. We want to take a look at what is the cause of that and give some thought to whether or not there may be some sort of trauma situation in that child's past history that is actually causing the symptom. In the next video, I am going to talk about ways to help children cope with trauma. Thanks for listening.